Just Claire right down at the other end of the table.
So hello again, good morning, good day, welcome. It's wonderful to have a full house for what promises to be a wonderful presentation and discussion. I'm Roger Mark D'Souza. I am the Director of Population, Environmental Change and Security here at the Woodrow Wilson Center. And I'm really excited about the topic that we have for discussion today, Harmony in the Forest, Improving Habitats for Species and People in East Asia. And Michelle, Lisa, and I were just chatting, and the three of us were all excited on a number of fronts. First, we were talking about how this part of the world is very often missing from these discussions. So we felt that this was really a nice and unique opportunity to make sure that we had some thoughtful dialogue on this part of the world. We were also talking about the urgency of linking these issues, and that there's a real need within the communities in where we all work to see these issues come together in real and meaningful ways. And those communities are also communities of practice, where we have a sense of, we get a certain training and perspective and see issues in the world from those lenses, and that we thought today we'll have an opportunity to share different perspectives from those different lenses. So we felt that that was an exciting opportunity for us. Those of you who know us well at the Wilson Center know that we are the formal memorial to our 28th president, and as some of you know, the only president thus far to have achieved a PhD. And in testimony to him, we focus on bringing the worlds of policy, practice, and academia together to really promote a better understanding of how we can inform each other and collaborate and work together. This the event today is being hosted by the Environmental Change and Security Program, which is 19 years old, and we look at the various connections between health, environment, livelihoods, population, and security, most notably under our HELPS project, which is a 5-year effort that is generously supported by USAID's Office of Population and Reproductive Health. In talking about our session today, we thought that we would actually start with Lisa. And Lisa said to me, as you have all looked at her background in the bio sketch that we have, she says, well, I'm based in Seattle, but I'm really more in Papua New Guinea. She says, I've been going back and forth for 20 years, and that she really feels that to a certain degree that is very much has become home to her. Lisa is the director and founder of the Tree Kangaroo Conservation Program in Papua New Guinea, and she also serves as a senior conservation scientist at the zoo in Seattle, in Washington, and has been working with indigenous landowners, scientists, students, educators, government officials, and healthcare professionals from a number of countries, and really thinking about new ways to think about protecting wildlife and rainforest habitat, and also supporting local communities. So I'm going to give it over to Lisa.
Thank you. Okay, well, I'm very honored to be here today to get to speak with you and also to share in a discussion later on. And, and thank you for the introduction. I'm from the other Washington, on the other side of the country. But as you said, all of my work is in Papua New Guinea. And I'm very excited to be able to share the work of the Tree Kangaroo Conservation Program. And I want to make mention that this work is not just the Woodland Park Zoo's or the Tree Kangaroo Conservation Program's work. It's really done in partnership with many different organizations. And specifically, I want to point out Conservation International, who is one of our major partners, and then also the Balanced Project, which is funded through USAID. So I'm very excited to be able to represent that project as well, and I'll be speaking about it today. So I want to take you to very, very East Asia, and sometimes Papua New Guinea is not included in when Asia is talked about. We're sometimes referred to as Oceania or Melanesia. But this Papua New Guinea, and most of you know this already, but it's just north of Australia, and it's the eastern part of the island of New Guinea. So the western part of New Guinea is Indonesia, and then the eastern part is an independent country of Papua New Guinea. And it's been independent for over 30 years. And we work specifically on the Huon Peninsula, and even more specifically in the area of use. And so I'm going to be referring to use a lot. It is actually a political boundary. It's a local level government, but it's also 3 watersheds. And so we look at it as also a landscape of the Yupno, Orawa, and Somme rivers. But what's special about the Huon Peninsula, when I first went there in the mid-90s, was that it was considered by Conservation International a scientific unknown. And so for a conservation biologist, you can't get better than that. So, and it's also the home of an endangered species of the tree kangaroo, and it's the only place where that tree kangaroo lives. So that's where we're going to be focused. My program is a site-based program on the Huon Peninsula. Now, Papua New Guinea is known for its incredible biodiversity, including birds of paradise. That's probably the most well-known taxa for Papua New Guinea. And these are 3 birds of paradise species that are only found on the Huon Peninsula. They're endemic to the peninsula. But they're also home to the Matchies or the Huon tree kangaroo. And this is a photo. The reason why I'm showing this photo is to remind people that they are tree kangaroos. They are actually marsupials. And this is a young joey coming out of its mother's pouch. And this is actually a photo from Woodland Park Zoo. We have a captive breeding program at the zoo, as well as many other zoos in North America. But this is where I started my research on reproductive biology and behavior of tree kangaroos. And then after finishing that work, went on to Papua New Guinea to look at the status and how to help this endangered species. And what I found is when I first went to New Guinea in 1994, that tree kangaroos are also very important to the local people on the Huon Peninsula. These are the Use people. And this is actually a group of students that are dressed up for a celebration. And you might notice that they are wearing tree kangaroo tails as headdresses. And so tree kangaroos are important to them both culturally, and then also it's their major source of protein. And so it's very important to them. However, the populations of tree kangaroos were going down quite rapidly. And so when we first started our program, and continuing to this day, we are doing a lot of biological and ecological research on this endangered species. This is Gabriel Porolak, who's our graduate student from Papua New Guinea doing radio telemetry work. He's putting a radio collar on a female tree kangaroo here. But we've been trying to get a sense of their habitat use, their home range, their feeding ecology, to learn as much as we can about the species so that we can then help them in the wild. But our approach to this work is, yes, it's important that this is an endangered species and we want to protect it. But equally important are the 3 other sort of pillars of our work. Other one is habitat protection. So it's really thinking more broadly, not just one species, but the habitat that also houses many other wildlife species, both plants and animals. And then the communities that live in the same area in use. And so we look very much at the community needs and livelihoods. And then equally as important is the capacity building for the local communities. And so we put a lot of effort into empowering the local people to be able to manage their natural resources. One thing that's unique to Papua New Guinea, and one of the reasons why I love working in this country, is the land tenure system. And almost all of the land is owned by the local people, the indigenous people. And in use, 100% of the land is in the hands of the local landowners. And this makes a huge difference for doing conservation work, because it's their decision of how to manage their natural resources and how they do conservation work. So from the very beginning, we have been working hand in hand with the local communities on our conservation work. And so our main goal has been to create a protected area on the Huon Peninsula. And land is owned by clans. It's clan land ownership. And so the way we've approached it is each clan owns a portion of the land in this area. And from the very beginning, we talked about each clan setting aside a portion of their hunting land, so that we were not going in and telling them to stop hunting, but we were saying there's a need for creating a sustainable natural resource for them, for food and for cultural aspects. And so over 10 years, we worked with all the different clans, and this dark green area is a compilation of all the different areas that they set aside. And the middle area is actually a grassland. And so this is all rainforest along here, but it goes all the way down to the coast, including coral reef areas. And in fact, this became the first conservation area for this country under the Conservation Areas Act of 1978, when Papua New Guinea first became independent. And so this was a huge investment for the local community to decide to try to create the first conservation area. And then we worked with all levels of the government, up into the national government that had to gazette this conservation area. So it's been quite exciting, and it was in 2009 that this was declared the use conservation area. And this is just a quote from the president of the community-based organization. He's also one of our researchers for the Tree Kangaroo Conservation Program. And I think this really speaks to the fact that the local communities are thinking about their future, they're thinking about their children and their grandchildren, and how to create a sustainable landscape for themselves. And so for the long-term success of this conservation area and this community, and it's a community of about 15,000 people, of about 50 different villages. So what we need and what we're doing is we're creating structures, institutions, local institutions to help manage this conservation area. And some of these things I'm going to go into more deeply, and others I'm just going to mention. But it's also important to have long-term monitoring programs. Everyone knows when you set up a conservation area that you need to do ecological and socioeconomic monitoring long-term. So we have a program of community rangers that monitor the area. We're also doing a lot of mapping and land use planning. We have a whole health project, and that's what I'm going to talk about the most. We have ongoing research in the conservation area to help inform our management. We are really focused also on education, and then community livelihoods, and then another big area that we focus on is long-term financing, to make sure that the local communities know that there is support for the long term. And that's another area where we partnered with Conservation International through their Global Conservation Fund, and we've actually been able to set up a long-term conservation endowment. So we have a small endowment that will give consistent funding that pays for part of the management of this conservation area. So it's a very challenging place to work. I don't know. I've been told by many colleagues that Papua New Guinea is probably the hardest place to work in the world. I don't know because it's the only place where I work. But it is a very dynamic area and very, very beautiful, but very difficult. The area where we work has no roads, so the only access to these communities is by small plane or on the coast by boat. And then after that, there's just walking trails. So we walk from village to village or into the forest where we do research. And it's a mosaic of villages and gardens and coffee gardens and then the forest itself. And then also what Papua New Guinea is famous for is the amount of languages. There's over 800 languages in this country alone. I think it's more than any country in the world. And so just within our area of 15,000 people, there's at least 7 distinct languages. And so, of course, that creates some challenges, but there's also a pidgin language that everyone speaks, and that's how we get along, that and English as well. But it just speaks again to the diversity. So there's the biodiversity and then the cultural and language diversity in this area. And so I mentioned land use planning. Because the land tenure system is such that it's clans and small groups of people that own land, we have to do land use planning on a very small scale. And so we have staff members from the Tree Kangaroo Conservation Program that are working with each, we call them wards, which are groupings of villages, that set out how are they going to plan for the future in terms of the conservation area, their hunting area, their agriculture area, et cetera. And then also how are they going to protect their rivers, their watersheds. And so they're thinking ahead, and this has never been done before in Papua New Guinea to do land use planning like this. And so it's really exciting, and we're also being seen by the national government as a model for the country. And so this has been very exciting, and the local landowners who participate in the land use planning are very excited about this and to be able to think ahead and think about their children and their grandchildren. We also really have been focusing on linking development and livelihoods to this conservation area. We were very fortunate with Conservation International to get a grant from the German government through their International Climate Initiative, through the German Development Bank. And so for the last 4 years, we've been able to embark on a few projects that have helped us really push this project along. And one of them we identified for, in terms of agriculture and livelihoods, is coffee. And the Papua New Guinea, oh, and right back there, Janet Edmond from Conservation International is holding up a bag of coffee. And what I want to say is that we have been able to link the farmers in this area, the farmers that have set land aside for conservation, who have been growing coffee since the 1960s, but they've never been able to get a fair price for their coffee because they've always had to sell them to brokers who then sell it, you know, and they're not making very much. And so in Seattle, knowing that it's the center of the universe for coffee, we were able to work with Cafe Vita, which is a small coffee roasting company in Seattle. And they were very interested in the fact that this coffee was linked to conservation. And so they, for over a number of years, they sent a buyer out to New Guinea, and we worked for a long time about how to produce the best kind of coffee beans, and doing workshops on how to produce, how to prune, how to dry their coffee beans. And now I'm happy to say that that bag that Janet held up is the second year of beans that have come over to Seattle, and we're now selling them. It's actually, you can get it online, but we sell it in Seattle. And it's very good coffee. But what's important is that the landowners, this is a direct relationship between the roasting company and the farmers. And they are making 3 to 6 times as much money as they made before. And this is money, they don't have a huge cash economy, but this is money for school fees and for paying for health. And so it's really essential kind of costs for the families. And so it is very exciting, and the farmers are definitely very excited about this project. We also, in the lowlands, they grow cocoa, so we're also in discussions with a chocolate company as well to do the same kind of project. We've also been working in the field of education, and the way we approach our work is we ask the teachers or the provincial government, what are the needs? And one thing that we found out with these remote communities is that there were not enough teachers, and that teachers from the towns that would be positioned to go out there wouldn't stay very long because they didn't want to live in remote areas. And so we set up a scholarship program, and these are 3 of the 20 graduates so far of local use people that get a scholarship to go into town for 2 years, get their teaching credential, and then they go back and make an agreement to their own community that they'll teach for at least 6 years. And it's working really well, and I'm happy to say that many of the schools, when I first went into use that were shut down, that had no teachers, are open and have expanded. So that's been a very successful program, and that's continuing. But the main thing that I wanted to talk about today is our community health programs. Back in 2005, we realized that in addition to education, we really needed to focus on the issues of healthcare, because these are such remote communities and they are not getting the services that they're supposed to get from the provincial government. And so we went in with a couple of American doctors who volunteered to do this, and then we met with the provincial government and then the local healthcare workers in use. And we did a tour around to determine what were the priority needs for health, and how could we best link the use community with the provincial government so that they could get their needs met. And so, in many ways, I feel like, I'm a conservation biologist. This is not my background in healthcare, but I felt like I could be a liaison between the communities that we had established a relationship with and the health department on the provincial level. And so some of the big issues were immunization program. There had been no children immunized for over 5 years in the time that I had been there. So we set up a vaccination program, getting solar refrigerators into some of the aid posts, and then working with the provincial government to train the healthcare workers to administer the vaccinations. And then child and maternal health, that was another major one. And that's where I ended up meeting first through Janet Edmond. I learned about the Balance Project, and Linda Bruce is here as well, representing the Balance Project through the University of Rhode Island. And what I learned was that project, the Balance Project, was all about linking population health and environment. And they were looking for some other sites to try out some of the practices. And we were fortunate enough to get a grant funded through US aid for trying some of this work in the use community. So I know all of you know this about population, health, and environment. But in some ways, as a conservation biologist, it was new for me. And it was new for me to really significantly link population, health, and environment. And I think one of the things that I'm hoping to get out of the discussion today is how we can do a better job of that, and how we can really inform other conservation programs worldwide to do this, because I think it's so vital to link population, health, and environment with local communities that are trying to do conservation work. And I know that it's talked about that a big focus is on high biodiversity areas. And Papua New Guinea is certainly one of the main areas in the world that has high biodiversity. And there are several others, of course. But that's a big thing of linking where are there endangered species, where is there high biodiversity, and then linking that with the community needs. So, and one of the things that really rang true for me in in getting a grant from the Balance Project was the focus on empowering the local community to become the population health and environment champions for their own communities. And so we talked a lot about how do we do this and how do we get the word out and the training out there. And so we started this project called Healthy Village, Healthy Forest, integrating healthy families and conservation in the use area. And I want to just point out, this is Dr. Joanne Castro, who is a doctor from the Philippines, from PATH Philippines, and she is the scientific and health director for the Balance Project. And she came out to Papua New Guinea several times to work with our team on training the provincial level health workers, as well as the midwives and the local community healthcare workers in use. This is one of the posters that came out of these workshops to educate the local communities on looking after your families, carefully planning your families, and why it is important to link conservation with health. And it's been very fascinating for all of us to have these discussions in the communities, because you can talk about you need healthy water. You need enough wildlife in the forest to be able to hunt to feed your family. All of these links that sometimes doesn't get talked about in conservation projects. And so it's been really great to have this opportunity to really focus on that interconnection. And so we've done many trainings over the last couple of years, and these are 2 local healthcare workers that are giving certificates and gifts to some of the midwives and the healthcare workers that have gone through one of the PHE trainings. And we were also able to train some of the youth so that they can then interact with other youth in the communities. And I would encourage you later on to talk to Linda maybe more about the Balance Project and where they've done it in other places as well. But this has been very, very successful. I mean, we've just finished this 2-year project. I was just back in New Guinea in April, so last month, and was able to talk to Mr. Hessing, who's one of the lead healthcare workers. And he was able to share with me that having the knowledge about family planning, taking care of your family, really figuring out how to have the healthiest families and how to live in your environment in a sustainable way, that he feels like the community is getting that education now that they didn't get before, and it's very exciting. And so I really think about, you know, as a conservation biologist, the linking of sustainability of wildlife and endangered species, habitat, but also of the local people. And I'll stop there. Thank you.
Thank you very much, Lisa. One of the things that I really liked about what you had to say is you kept coming back as a conservation biologist, and you kept expressing for us this sort of new perspective and world that had opened up for you. And, you know, again, thank you for taking us to very East Asia and to this area that was once a scientific unknown, and giving us a sense of the conditions there and how hard it is to work there. I liked that you had pulled together the work around species conservation, habitat protection, community benefits, capacity building. You talked about that in terms of coffee and livelihoods, the education programming, the community health needs. Very pleased, of course, to see child and maternal health as part of that package that's so important for the community, the Healthy Village, Healthy Forest program. But was also very happy to hear you talk a little bit about systems and putting systems in place, not just for decision making and involving governments at various levels, but also working within the local context. I was very intrigued by your mention of the endowment. And I certainly would like to hear more about that, because I think that's exciting and new and promising, and we'd like to learn a little bit more about that. I liked a few phrases you used. Coffee linked to conservation. Thought that was a nice phrase. Conservation, as a conservation biologist, this is not my background, but I realized I had a role to play. You know, sort of just recognizing that there's a certain opportunity, but also obligation, and for taking that up. And once again, as a conservation biologist, PHE was new for me, and I had to think about how to significantly link population and bring this in to the equation of what I was doing. So thank you very much. That was a wonderful presentation. So we're going to now move to your neighbor, Michelle, who is going to tell us a little bit about the work that she has been doing as Managing Director of Health in Harmony. And as you know, Health in Harmony specifically looks at addressing the direct link between species loss, environmental destruction, and questions around human health in one of Indonesia's national parks, and really thinking about how they make it possible for families in and around the park to access high-quality health care through conservation-oriented, non-cash means. So Michelle's going to tell us a little bit more about her work and her perspective. Michelle?
So we're going to mouse this over. That one?
If you go right here.
That one? Okay. Well, I want to thank the Woodrow Wilson Center for hosting this session and bringing this collaboration together. I want to thank all of you for attending this afternoon. And with that, I will launch into this presentation. Just want to make sure I understand the front and the back, or these little, okay, all right. So in the early 90s, when working as a primatologist, our founder and president, Dr. Kinnery Webb, learned a very hard lesson, that to save the rainforest would mean providing the means to improve community health and save lives. With the location of Osri established, having completed no less than 11 site visits throughout Indonesia, a baseline survey was essential to understand and illuminate the specific health problems and conditions leading to those health problems, and to gauge local opinion regarding saving one of the world's biodiverse treasures, which is the Gunung Palung rainforest. In Borneo, they have experienced the most rapid decimation of rainforests anywhere in the world. When Kinnery began this work in the 1990s, it was said that an orangutan could cross Borneo in the canopy of the rainforest, and you will see shortly how that is tragically not so anymore. Today I'm here to talk to you about our 5-year survey and the results of that survey that today shape OSRI's programs in conservation and health care, and fundamentally evolve from discussions with the community, which we call radical listening. Everything starts with radical listening to the community about what they need and want and desire, and how they will shape those outcomes. So where in the world are we? What's really lovely is that not only where Lisa is working is close to us, but we are close to them. And I noticed on one of her slides that I think down in here, right? Okay, so here we are. This is Borneo. This is the Indonesian area of Borneo. As you can see, as I was saying, the rainforest has been decimated, tragically decimated. And here is our little program, Sukadana, that is at the foot of the Gunung Palung rainforest, which is home to about 10% of the world's remaining orangutan population. The Health and Harmony model and its expression at OSRI was founded on the principle that poverty, lack of access to information and knowledge, and unmet healthcare needs lead to environmental destruction. And in order to address the health and conservation of the forest, we had to address the health of the community. In addition to its healthcare program, OSRI provides its 30 partner villages with on-site farm training, organic farm training, and other sustainable livelihood programs, along with conservation education and voluntary reforestation activities. The model is fully expressed at OSRI, which is our program partner. OSRI standing for Alam Sahat Lestari, meaning health and everlasting nature. The model works on 4 different levels: by improving access to the quality of health care, educating about health and conservation linkages, providing alternative livelihoods to illegal logging and helping alleviate extreme poverty, and finally through conservation and preserving of the Nangpalang rainforest, as I said, home to 10% of the world's remaining orangutan population. At OSRI, volunteer doctors from throughout the United States are teaching patient-centric sustainable medical care, while conservation volunteers work side by side with Indonesians on organic farm training methods and reforestation. Today, we can say with faith that the lives of the people and the health of the forest are both improving, as evidenced by our survey results. Before I get too far into those survey results, I would like to paint a picture of this magical place for you. I just came back from having been there for 3 weeks, and not unlike where Lisa's travels take her, it is one of the hardest places in the world to work, and yet it works its magic on you over and over again. I was privileged to take 12 women of Dining for Women with us who had never experienced this part of the world, and we came away with 12 inspired and humbled ambassadors after having experienced what this place is and how all its programs are networked together. So what we have in West Kalimantan is a demographic that favors children, but the age distribution has not changed radically between 2007 and 2012. What we have seen is a 41% increase in the number of individuals who have finished grade school and a 37% increase in the number of individuals with an education beyond grade school in just the last 5 years. And today, OSRI is leading a conservation education program with over 100 children already enrolled in an after-school program and an OSRI summer program that will begin its 2nd year in about 30 days. That's correct. Yes, I'm sorry. In Borneo, not unlike what Lisa was describing, there's an Indonesian area, there's a Malaysia area as well. So sorry about that, if that was a misunderstanding. Little has changed in the last 5 years in terms of religion and ethnicity. Islam remains the predominant religion, followed by Catholicism, with Dayaks, the group indigenous to Borneo, still practicing their own animistic practices. Household size has declined slightly, and farming remains the primary source of income for 67% of the individuals. What's interesting is that food, followed by cigarettes and healthcare, represent the 3 largest expenditures of a family's budget. That farming has increased as an occupation is also confirmed by land use patterns verified by the survey. There has been a nearly 40% increase in paddy or wet rice farming, a 31% increase in orchards, and an 8% decrease in dry rice farming, which has been responsible for the unsustainable slash-and-burn agricultural practices in Borneo. Here's a picture of our founder and her colleague, Hotlin. Kinnery often wears kabayas when she makes her presentation, and I will admit to being a bit nervous and overwhelmed with the opportunity and the honor to present these survey results, and so I wore one hoping to pull in our amazing founder's energy. She is truly a remarkable woman. 2 years ago, she was stung by a box jellyfish. Its venom is 100 times more toxic than a cobra bite. And she would say, if she was here today, that at that moment she had an epiphany, that it was time for her to step back from both OSRI and Health and Harmony to see how both programs could grow without the shadow of a founder. She remains joined at the hip to us and continues to be the center of our universe in many, many ways. But I have to say that her decision as a founder to let both of these organizations and its leaders stand on their own has been a decision of incredible courage. and one that I have doubled and tripled my respect for her around, and appreciate how close she does remain to all of us. So we're going to jump into the survey a little bit more at this point. So in 2007 and 2012, we had trained nurses, and all of the households were randomly selected by lists that were provided by the village leaders. This is a map of the villages that were surveyed. The first baseline survey in 2007, 1,300 households were surveyed, representing about 6,300 people. In the repeat survey in February of 2012, 1,400, nearly 1,500 households were surveyed, again representing about 6,300 individuals in a watershed of a population of about 60,000. To date, we have seen 34,000 patients at our clinic, and though crowded and far beyond capacity, it is indeed having an impact. OSRI patients are significantly more likely to have completely immunized children. They are less likely to have fevers, TB-like coughs, and are more likely to use a restroom. They are also less likely to defecate in the river and less likely to smoke. OSRI patients, in fact, are no richer or poorer than non-patients, but they are less likely to be worried about accessing or affording health care. How does this happen? Let's look at a typical day at OSRI Clinic. Nearly all of those 34,000 patients would have arrived in the early hours between Monday and Thursday during the week and taken one of 25 numbers. Clinic opens at 9 a.m. following morning meeting at 8 a.m., which is attended by every member of the OSRI staff that is on site. That means whether you're a cleaning person or a doctor or a driver or the Goats for Widows coordinator, you are at morning meeting. And I have seen more problems solved in 1 hour there than I've seen in some of the meetings we've all convened. Today, the clinic is treating as many as 60 patients a day, where only a few months ago the intake was between 35 and 40. Fridays are reserved for trainings and special classes, such as vision and midwife training. After being checked in, a presentation is provided by one of our staff members that makes the linkage between conservation and healthcare, and then each patient needing treatment is seen by a team consisting of the Indonesian physician, a nurse, and an international volunteer doctor who assists in the diagnosis and treatment plans. This collaborative approach focuses on patient-centric, sustainable medical care in an exceedingly busy clinic. Our vision is to build a community healthcare center, surgery center, and training center, which we hope to break ground for this August. So what have we achieved? Child mortality has significantly declined. Though traditional birth assistants are still the primary attendant at birth, more babies are being delivered by midwives, and of the 60 midwives in the region, OSRI has trained 58 in 2 different trainings, and we will complete another training this November. Births per mother are down. Birth control use is more prevalent. Overall, immunization rates are dramatically improving, with as many as 25% of the children now receiving at least some portion of the immunizations that they need. Water, hygiene, and dental health are also all critical pieces of this health puzzle that our survey looked at. Disease symptoms across the board are down. Disease symptoms, many of which are markers for TB, malaria, and other respiratory health issues that plague many places in the developing world, and World Health Congress after World Health Congress has identified these issues as some of the top priorities in the world that we have to address, and I'm here to tell you at OSRI, we are succeeding. Unfortunately, fewer than 30% of those surveyed have actually seen a dentist, although we do have dental services on site. But with programs such as exchanging bamboo stakes for toothbrushes in support of rain reforestation efforts, we expect to see a change in that number over the next 2 to 5 years. There has been a measurable improvement in more hygienic practices, as is evident from the survey. And again, with improvement in hygiene, we have fewer conditions contributing to disease, diarrhea, malaria, and TB. We're seeing a greater percentage of use of public pipes, wells, and rain barrels, which means people are able to access cleaner water, again, reducing common disease symptoms. We also looked at smoking rates, awareness of HIV, and usage of mosquito nets, all contributors to health. The number of men who smoked has declined by 14%, nearly 15%. The number of women who smoke has declined by nearly 65%. And the impact of this is huge when you consider the fact that smoking costs on average about $342 a year, and the average daily rate income for a family in West Kalimantan is about $1.44. So that decrease is a huge economic factor in community health. In July 2009, OSRI gave away 4,000 mosquito nets, not for free. We don't give health care for free. We don't give mosquito nets for free. We believe in a fair transaction, and every one of those mosquito nets was paid for with seedlings and manure. Here we have it. Yes, very excited. So let's take a look for a second now at the conservation highlights. 99% of the people surveyed believe it is important to preserve the Gunung Palong because, as Lisa also observed, they want it to be there for their children and their grandchildren and their great-grandchildren. Over 80% of the people surveyed in 2012 in general believed that the park needs protection, but interestingly enough, 90% of the villagers from villages that are illegally logging believed that the park needed to be preserved. Although not a survey topic, I think it's an important side of the coin. 81% survival rate of seedlings. That is unheard of even here in the United States with our most sophisticated reforestation and restoration efforts. We have completed 8 to 10 hectares of degraded forest land replantings. 35,000 seedlings have been produced in our nurseries, 22,000 of which have been planted. The balance have been reserved for our OSRI Kids and Trees for the Future program. And 30 forest guardians have been hired to work collaboratively with the villages and OSRI. The Forest Guardian program is a remarkable program that the communities around the Gunung Palong asked for. They wanted to have leaders in their villages that could help serve as a liaison and could help facilitate training and the shift to alternative livelihoods besides illegal logging. These individuals are truly the bridges between OSRI and the community. And our e-letter this month actually features the Forest Guardian program and provides a couple of profiles of these remarkable individuals that are truly paving the way to change. The number of active loggers in the last 5 years has declined by no less than 68%. This has been verified by 2 other studies, Cullen in 2008 and the Earth Institute of Singapore. Just rest your eyes on that for a minute. We are truly having an impact. But the question is our discount working? And you may scratch your head and wonder, what does she mean by that? So villages that do not log in and around the Gunung Palong are what we call green villages. They pay approximately 50% of what a logging or a red village pays, or about $5.50 versus $9.60. The challenge clearly is to further get the word out more broadly and more deeply. Nevertheless, we are seeing an increase in non-logging villages from nearly none in 2007 to 10 out of 30 today. And we continue to see that doing nothing but improving. This is a testimonial by one of our village headmen. 5 years ago, he says, when I helped design this program, there were more than 100 people in my village doing illegal logging. Now there are less than 10. One effect I have seen of OSRI is that loggers can become farmers without startup money because now they can make fertilizer from the waste around them. All along the road that 5 years ago was just grassland, there are now organic vegetable farms and rubber trees. Indeed, when we began this program, the farmers of West Kalimantan were using chemicals that were just exceeding their annual budgets. And we have learned and taught over 350 individuals how to make compost from manure and other materials easily available on site. Let's look at the economics of the survey for a moment. Household assets measured by motorbikes, phones, and televisions have all increased. Animal ownership of cows and goats has also increased, probably directly as a result of our animal husbandry program. We have provided cows to the farmers to supplement the manure production, and we also have initiated a Goats for Widows program, and the manure from the goats is used to pay for services in the healthcare clinic, as well as sold to other farmers throughout the community so that they too can have a rich compost and fantastic vegetable gardens. The worry about affordable care I touched on a moment ago. Although OSRI's cost is comparable to other options such as the government clinic or traditional healers, it is still dramatically less than the government hospital, and I offer a story that Kinnery has shared many times. A young woman came into the clinic about a year ago with scabies. Their family had spent no less than $500 seeking a cure to a very simply cured problem. For $5 at OSRI, she was cured. And it's for reasons such as this that the OSRI community members are also significantly less likely to worry about or have to choose between food and medicine. Can you imagine sitting around this table if you had to choose between food and medicine and it was your child or your mother or your father that had been injured? OSRI patients are less and less worried about having to make those choices and living in security. Income was not found to be a significant factor, whether they'd been a patient or not. But let's look at the forest. What's happened to the rainforest? Although 44% of the loggers thought it was okay to cut trees, 56% of those individuals did feel as if the park was threatened, compared to 41% of non-loggers. And a very small percentage, between 1% and 3%, actually thought that nothing could be done to stop logging, which means the majority of the community believes that there is a way forward. And if given the choice, 98% of those community members surveyed would rather have alternative work than logging. So how effective have the OSRI programs been on this question? So I should note that the survey was done a mere 9 months after our Forest Guardian program was established, but the results from that are still pretty dramatic. 20 of the surveyed loggers said they knew a Forest Guardian even though the program had been in effect, as I said, for only 9 months prior to the survey. Of those 20 loggers, 12 had already ceased logging and another 5 were considering stopping. And of those that had quit logging, 52% had become organic farmers, making an income at least double that of what they were able to achieve through logging, and an income security heretofore unknown. Other threats to the park we also looked at: wood fuel stoves. Usage has declined by 40%. Slash and burn agricultural practices that destroy vast tracts of the rainforest are also on the decline. Perhaps one of the greatest treasures is the social capital that is earned through radically listening to and supporting community solutions and designing solutions in and with community. Respondents felt overwhelmingly positive about OSRI's work for improving health and conservation. So you can see the impact of OSRI has indeed been profound. The model is working. It is improving the quality of health care. OSRI has trained hundreds of doctors and nurses and 60 midwives. The community opinion of OSRI is exceedingly high. The barriers to health care have been decreased. There is clear evidence that we're able to prevent disease. People know more now today about healthy practices. Mosquito net usage has increased. Diarrhea, TB-like coughs, and weight loss has decreased. We've improved the knowledge about healthy ways to make a living. We've helped increase household assets and income. Loggers are switching to other work as a result of our alternative livelihood training program in organic farming and animal husbandry. Indeed, it seems to be working in this little corner of the world that is indeed one of the hardest places to travel to. There is a magic that we wish to share with the entire world, and our vision is to replicate this model not far from where Lisa is based and studying tree kangaroos. We just completed a 10-day site visit to Raja Ampat with a remarkable team, a member of my staff, her husband, 2 Fulbright fellows, and 2 individuals who are leaders at our Osri clinic in West Kalimantan. And the punchline was, how fast can you get here? Thank you.
Thank you very much, Michelle. Win, win, win. Very interesting to hear sort of all of these successes and improvements. And I already like the start of this radical listening approach and how that seems to have radiated across various components of the work that you had been doing in the last few years. Very interesting, this sort of green villages and red villages and this discount mechanism and how that was being implemented. And nothing's for free, this idea of sort of a fair trade. You know, we're not giving out these free mosquito nets. There is sort of a mutual exchange there. I'm also quite intrigued with your founder stepping aside, sort of that decision and what that means in terms of the sustainability of the work and how it moves forward and how we can also learn from that model with other projects. I was also quite struck when you spoke about the household expenditures. You talked about food, cigarettes, and healthcare, and it seemed to me that you tried to remove cigarettes from that equation and talk about, well, how do we increase access to food and healthcare, and how does public health and maternal health fit into that, and how do we put that in a broader context of income security and livelihood options. So thank you very much. That was fascinating. I also want to scratch below the surface a little bit to hear about what did not work when and how you sort of addressed those issues. So I hope that would come out a little bit in our discussion. So let's open up the floor for discussion. And because we are recording this, I would say my colleagues are ready with microphones. Please identify yourself and give your affiliation. So questions, comments, thoughts, reactions, please.
Hi, my name is Christy Moses. I'm a returned Peace Corps volunteer and a graduate of UMD, and I was very interested in these projects at that time. So I know from having followed a bunch of the literature that a big discussion point with these projects is scaling up and how we do that. And so I want just to ask what, how you perceive the idea of scaling up and how far and what does that mean, and then also these projects are very intricate, very complex. There's lots of layers, and so I wonder if there's kind of a point in scaling up when they start to maybe fall apart because there's so many components to these, and maybe would they work better scaled? Would they work like we would want them to scaled up, or is it best that they remain small in these remote areas and one at a time?
Great, thank you. So should we scale up? How would we do that? And if we were, what are the risks?
I'll start. I think it's an excellent question, and we think a lot about that. I think one of the things that I've learned from the work that I do is that it's very important to make a long-term commitment to a site, and especially the lessons learned in Papua New Guinea, because there have been a lot of projects and programs that have not worked, that have failed, unfortunately. And so I learned not to spread out too much, and that we really made a commitment to the use community. But in so doing, to work very closely with the provincial government, district, provincial government, and national government, so that we can keep sharing what we're doing at one site, and with the idea being that if we can model it and get it right over a long term in one place, then we can share and scale up. And so that's actually, we're in the midst of that, because from the grant that we got from the German Development Bank, some of the funding was for dissemination nationally. And so we held workshops over the last couple of years with other NGOs and with different government representatives of how we can share the lessons learned and how we can scale up. And so one example is that now the national government has been in contact with us with the land use planning, because this is new for conservation projects in New Guinea, to do it in other provinces. And so some of our staff may end up being, do the training of the trainers in other areas. The same thing with just creating a conservation area. We now have, there are 5 other conservation areas that are proposed that are in the national government right now, and we're working with them. So I believe that it's important to be committed to one place, and you can't do it all, but you can work with other partners and groups to scale up. It's the same thing with the Balance Project. Because we invited other groups and the provincial government to participate in the trainings, they see the value of it, and now they can take it and try it out elsewhere in other parts of the province. So I think it's a real balance, because I think it is, a lot of funding comes for 3 years or 5 years, and you can't get a lot done in short periods. And so I very early on made the commitment just to our place. And in fact, we just created, and it just got registered, a local NGO in Papua New Guinea for the tree kangaroo conservation program. And in the mission, it is site-based. So we're only committing to go as far as the use community, but share our lessons learned. So anyway, that's my response.
Yeah, I would echo everything Lisa just said, that modeling it and getting it right in one place is first and foremost the job. But I would say the underpinning of that is listening to the community and designing solutions in and with community that are sustainable over time. I think the fact that we did the survey is a piece that helps launch scaling up, because we understand what works, what doesn't work, and where we might have some opportunities to improve. Fundamentally, one of the key factors in scaling up, this was underpinning the recent Raja Ampat trip by our delegation, was whether or not there was support from the government and the community to be there, and an understanding of what the conditions were that were leading to poor health care and or the inability to seek different livelihoods. I think there's also a critical importance of being very true to your mission. And here we have the situation unfolding in a rainforest environment, and you might scratch your head, but you're going to a marine environment, but really the issue is still the same. There is inadequate health care. When a family member is struck down for any reason, the population has to go to these most amazing coral reefs and practice unsustainable fishing practices to earn the money to take care of their family member. And so, it's a different environment, but the same underlying conditions are there. And the importance of having the government and the community buy-in and understanding that our model, first and foremost, starts with community is absolutely key to scaling up.
Linda?
Thank you, Lisa Michelle. I couldn't agree with you more from my 5 years working on the Balance Project and seeing other countries also sort of struggle with first getting their model up and running, because there's, people think if you have 3 years to do a project that it takes a while. First of all, these places are very remote, right? Exceptionally remote. People forget how much work it takes just to get to the site, how much money it costs just to get to the site. So sometimes it takes twice as long to get the same results as if you were working in a nice, cushy city clinic, which even could be in a slum, but you could get there in an easy bus ride or rickshaw ride. But the other thing, what I'm learning from the scale up in the Philippines is that everybody assumes that if you scale up, you're scaling up to other sites that are exactly like your perfect model site. And that's not true either, because each site, even though it's the same country, same characteristics, have different idiosyncrasies. Some governments are very pro, other infrastructures are different. So when we do scale up and get to the point where we do scale up, we do, and I think this big message to donors, but I don't see any of them here today, is that we need to allow for those hiccups and learning lessons even from scale up, that we can't say scale up is an end all and it'll just happen automatically. It also is a bumpy ride along the way. So anyway, I thank you for bringing those points out, because with our seed grants, the purpose was for them to first go deep and establish and look what these models look like. And then once they're functioning, see if you can't expand to other areas.
I would just like to address one thing you said about donors and funding. We are certainly grateful for all of the public agency funding that we receive, but in fact, if it wasn't for the hearts of our donors that are captured as a result of our visions, whether it's saving tree kangaroos and habitat and community livelihoods, or working in the jungles of Borneo, if it wasn't for our donors and that we've touched their hearts and that they believe in what we're doing and are willing to invest in changing the face of global health, we wouldn't be able to do the work we do. And I am very grateful to several people sitting around this table who are Health and Harmony's donors and board leaders. Because government agency funding is absolutely the creme de la creme, but the real heart of it is our donors.
Very important reminder about sort of the importance of storytelling too, to get that message out so that folks really understand what this means in a tangible way, so that they can get their heads around it, so that if they wanted to invest in it, they understand what it really means and the difference that it can make.
Hi, I'm Rachel Yavinsky from Population Reference Bureau. Population Reference Bureau is organizing a population health and environment conference that is going to happen in Ethiopia November 11th and 12th, just ahead of the International Family Planning Conference this year. And it's going to be looking at stories from the field, networking among PHE practitioners, supporters, interested parties, and also how we can make the population health and environment integrated approach more long-term sustainable. So what I wanted to know from you guys is, if you were attending this conference, and we hope that you will be attending this conference, what would be your priorities for topics? Because that's where we are right now. What can help you guys the most to support your work?
And I'm sorry, Richard, just to add to that, could you talk a little bit about topics among whom? Who is discussing these topics, and how are they positioned to move it forward?
So
is it practitioners? Is it going to be folks from the field? Is it donors? Who are you hoping to be there?
Right, so we are actually hoping that all of the above will be there. Practitioners, researchers, donors, everyone who has a stake in PHE. This is actually a limited conference, so we have a certain amount of space and we're accepting applications, not just for presentations, but for attendees. And we want to make sure it's people who really are committed to the PHE field and who have something to add and can enrich the conversation. Some of this is going to be like a sort of general conference where people can present something that they're doing, but some of it's going to be a lot more guided, and we will have goals, for example, coming up with points about what is needed for monitoring and evaluation of the integrated approach and how to take that forward so that we can have evidence of the added value of integration. There's going to be certain things like that. Scaling up might be one of them.
And Lisa, from my interest, I would say, having someone with a conservation biologist's hat, how do you think for a forum like this, we can get one or two superstar conservation biologists in the room who may not yet be interested or know enough, but how can we get them engaged? So,
yes, absolutely. I mean, some people who can be really great to attend and participate in this will be people who, are really firmly planted in one sector, but who want to work on integration.
Yeah, I think providing the opportunity to reach out to, especially from my field, the conservation biologists who aren't really aware of all the work that's going on, the integrated work. This summer, actually, in Baltimore, there will be an International Congress of Conservation Biology, and I'll be giving a similar talk, and it's the only talk for the whole week that is about this topic. So I think there's a lot of work that needs to be done to get the word out. So I can talk with you afterwards about that conference and maybe having some people go to that to get the word out. But that's my goal as a conservation biologist. You were mentioning, you know, I feel the sense of responsibility. And so that any way that I can share with colleagues. Yeah.
And I would just add to that, I think you really summed it up in a phrase you used, evidence of added value of integration. I would hope that there are more and more presentations, whether it's the International Congress of Conservation Biologists or it's your PHE conference or the World Healthcare conferences that happen, that we really are focusing on those programs that have integrated the pieces that we're talking about today, conservation, healthcare, population. For many, it's kind of a mystery how it happens, but I think for those of us that are doing this work, it is absolutely urgent and imperative that we have the podium to help bring people into the network. You know, in terms of attending your conference, I would also say that there, you know, for a nonprofit such as Health and Harmony, we don't have the budget to be able to fly people to Ethiopia. That's the beauty of the virtual world. But
Oh,
fantastic. I can think of a couple of people at Osprey that would be fabulous speakers for you.
And I would say we're hoping it's more than attending, it's active participation in the conference.
Evidence of added value of integration.
So Lisa, one area that you mentioned in passing in your presentation that I would really love to hear more about is this idea of an endowment. And, you know, we in this community very often talk about long-term sustainability of these kinds of projects. We very often talk about micro-enterprise initiatives. We talked about revolving loans, and there's a lot of discussion about various models. Could you tell us a little bit more about what you have been doing with regard to this idea of an endowment, how that is working, and where do you see that going?
Sure. Yeah, I'm happy to talk about it because I think it is something it's not new, but it's fairly sort of modest in the sense of how far it's gone. Conservation International was able to get a major grant from the Moore Foundation for the Global Conservation Fund, and the whole idea was that there would be funding for a portfolio of projects. It's ended up being 38 projects around the world, to both create a protected area, do everything to create a management of the protected area, and then create sustainable funding for this protected area so that it doesn't fall into the trap of creating a protected area or a conservation project and then it failing. And so we were lucky enough about 10 years ago to talk with a Global Conservation Fund and get one of the grants for creating the protected area, and then it gets you into the track of creating an endowment. And so basically, Global Conservation Fund allocated a certain amount. In our case, it was $1 million. And then my institution, the Woodland Park Zoo, had to commit to raising the matching $1 million, and which they did. And then we raised a $2 million, which is, you know, a modest endowment, but it's still, what it means is that, and it's starting this year. We've capitalized it, we've completed it, and now we will be able to use about $75,000 a year towards the local support. All of the money goes back to Papua New Guinea for local staffing to manage the conservation area and support all the projects around that. And so the idea being that if you can create some type, it doesn't have to be full funding, but some level of secure funding in perpetuity, that gives the local community a sense of relief and a sense that you're not going to abandon them. And it gives a sense of support for the staff to leverage that endowment to raise other funds. And so that's why we're using the Coffee Project. That's a way that they can raise their own money. We are still doing grant writing and getting support, and I want to second what you say about the importance of donors and our partners. But it allows us to know that we have a certain level of funding. And it's really made a huge difference when the local use members, when they talk to me and they know that they have that, and that they know that their local use rangers are going to be funded every year. Psychologically, it makes a huge difference. So I very much believe in it. I know it's not an easy thing to create, and I think that Conservation International through Global Conservation Fund has a good model for it. Yeah.
Yes. Linda?
Hello, thank you again. I forgot to introduce who I was. I'm Linda Bruce, Director of the Balance Project, though Lisa referred to me several times. Michelle, just a quick, 2 quick questions. How long has this effort been going on in Indonesia? I think it's been a couple of years. And also, who are your donors?
So OSRI was founded in 2005. Yeah, and Health and Harmony virtually simultaneously. The baseline survey, the first one was done in 2007, and then the follow-up was completed in 2012. Our funders consist of one U.S. government agency right now, a number of foundations, and a very large and loyal pool of donors who are also engaged with us on developing the Community Health, Surgical, and Training Center, which will break ground in August. Also sort of relates back to an earlier question about scaling up. What we know to be true is that if we are going to replicate this model, we are going to have to train individuals in how it is practiced, and that will be one of the key functions of this training center. And we already have individuals that are ready to subscribe for 6 weeks to 12 weeks of training there, as well as members of the OSRI staff and my own Health and Harmony team that are ready to take on replication.
What is the difference between OSRI and Health and Harmony?
Great question. Health and Harmony is the domestic partner of OSRI. We are responsible for 3 tasks: all the fundraising, all the volunteers in the pipeline, conservation, medical, and other, which include architects, birders, and handy people to keep the place running, construction liaison people, and we're also responsible for telling the story to as many people and as many different audiences through as many different channels as we possibly can. Health and Harmony, if you will, is sort of the keeper of the flame, the keeper of the model, and it is fully expressed as a model at OSRI in West Kalimantan. And they annually provide a grant request to us. That is our promise to raise that funding. We raise that funding over the course of the year, and then just as a granting agency would, we grant that funding in a series of wire transfers, and at the end of each year, there's a very, very thorough grant report submitted to us.
So, Michelle, I was also curious, when you talked about the health component, you talked a lot about community health, public health, a little on maternal health. How strong is the reproductive health component of the work that you have been doing? Has that come out as a real community need and desire? Are you engaged in any talking to the community about access to family planning services? Does that come up at all?
It certainly does. Operating in the country that we operate in, which is predominantly Muslim, it is a topic that has to be addressed with the utmost care and diplomacy. The way that we do that is, again, by working in community, designing solutions in and with community, and the request was for the training of midwives, who not only are more and more attending births, but they are the liaisons in the community, helping families to better understand family planning as they want to. It is not a platform that we press. That's not our agenda. It's really important to us that these questions arise organically and are embraced within the context of community and the midwifery training that goes on.
Great. Yes, very delicate. So I also wonder, we heard a lot about the successes of both of you. What are the challenges? What are you not telling us? What has been really difficult? Where do you think you have failed? And that was a good failure because you learned from it. What are you struggling with now? What's difficult? What are you struggling with the most? If you were to reach out to the community that we have here and wanted more information to hear from other projects, what would be useful for you to know? So, and that's for both of you.
We certainly have a lot of challenges. I would say one of the failures or challenges for us was figuring out the best infrastructure for the long-term management of this community-run conservation area. And so we kind of did the best we could with the knowledge that we had, and initially we created a community-based organization that was all landowners. And the idea was that they were going to run and manage the conservation area. And pretty quickly what we realized was that they did not have the capacity to be the staffing of managing the conservation area. And so what we did was we focused on certain use members of the community that did have the capacity that became staff members of the tree kangaroo conservation program. And we realized that in addition to a landowner community-based organization that advises and make decisions because it's their land, they haven't given up rights to the land, there needs to be a technical NGO, and that's the Tree Kangaroo Conservation Program, PNG. And right now it's mainly use members as well as other PNG staff people that have expertise in either conservation biology or GIS and mapping, et cetera, education. So I think that was a big lesson, was what is the best and how do you build up capacity? And it is something that we're still struggling with, like managing the financial tracking of an NGO. So we're trying to go very slowly. I think one of the lessons we've learned from other groups in Papua New Guinea is if you just cut off and have an exit strategy and leave an NGO, there's a really high rate of failure. And so we're trying to do it very gradually to then give the tools and the education on all aspects of running an NGO. So that's one, yeah.
I would say on our side, first and foremost, developing trust in the communities. And that took something on the magnitude of nearly 1,000 meetings over the course of a year with community members. So building that trust, I think, is one. Another big one for us is that we do not do any bribes. And what that's meant for our community health, surgical, and training center is that it has been delayed by over 2 years while we stood fast in asking for a building permit without paying any bribes. And that building permit is now in hand. It is the first building permit that's been issued in West Kalimantan. So you know how hard we struggled for that and stand on that ethical pillar. Oddly enough, one of our challenges was how to make compost. You know, we all here in the United States just think that's an easy knockoff, but there it was a bit of a mystery, and the recipe for compost is a bit of a mystery. But it's a good recipe, and it's some of the best compost I have ever stuffed my hand into, that's for sure. Power is a big problem for us. It's known to go off frequently for up to 26 hours at a time, which makes the backup generator at our hospital and our clinic exceedingly important. But trying to get equipment like generators and hospital equipment to Indonesia is really, really exceedingly difficult. So anybody that has any ideas about how to ship things and make sure they get there would be a saint in our organization. Yes, and I see Kat, who is our incoming board chair, with her hand up and probably has an additional thought on what some of our challenges have been.
Yes, thank you.
And if I could just introduce yourself.
Hi everyone. It's been a wonderful talk. I'm Katerina Solos. Corporate finance lawyer is my day job. Health and harmony is my passion. Attracting these incredible people is easy, but, or I shouldn't say easy, but they're both the volunteer doctors from the West, the young Indonesian doctors, who will become an amazing network, if you want to talk about long-term planning, as they spread out throughout Indonesia. And they have come out of Jakarta to live in this remote place, left all the comforts behind. So that will be a long-term success, but it's a short-term challenge. And then the social capital of retaining our fired-up staff in remote is a challenge, and this remote location possibly too is going to be a challenge. That's not unique, but it is, when it works, it is a long-term success, but it is a short-term challenge. And so many of the, if you want to call it failures, I would just say challenges, are staffing and finding the right staff.
Great. Any final comments, suggestions, questions, thoughts? But I'd like to ask you to join me in thanking Michelle and Lisa. It's been a great discussion, very rich. And those of you who know us well know that we will have an event summary, which we will write up. The PowerPoints will be shared online. We are also going to be doing some video interviews with both Lisa and Michelle, and we'll be posting those in the next few weeks, hopefully. So you will have access to additional information to what was presented here today. So I would encourage you to continue to visit our website at wilsoncenter.org and also our blog at newsecuritybeat.org, and to follow us on Facebook and Twitter so that we keep this conversation going. Thank you very much. Please.
I'm Lola Reich, and this is Al Pierce, and this is Jeannie Shaw, and thank you. I am a member of a speaking club, so I'm able to project, but I'm very pleased to be here and to hear about both of your programs and to even learn more about the Health and Harmony, which we have known about for many years, and the three of us have heavily supported it and feel like it's such a viable, fabulous way to work with the people on the other side of the world and to use technology to help them achieve their goals. And I might say that Mr. Pierce over there had directed the School of Architecture at Georgia Tech, where he was a graduate of bachelor's and master's, to teach 3 degree programs in order to get this hospital designed in Borneo. And young people were excited to take the class, and it went for 3 semesters, didn't it, Al? And I wondered if Al wanted to say another word or two about that. And Jeannie has had events in her home over the years, too, to support the Health and Harmony. We both adore Kinnery. She's extremely dedicated and brilliant. So, Al, why don't you just say a couple words about that, please? Is it possible?
Please, I think it would be wonderful. And Gina, I would also love to hear, what would draw someone to come to your home to hear about this? So we could let's hear from Al, and then we can.
About 45 minutes will be. Well, one feature that no one has mentioned yet that I think is really needed, and I don't know how you control it, it's timing. Things falling into place at the precise moment. For instance, I was approached by Kinnery on one of her visits to the U.S. a few years ago, and she said, I need some advice. And I said, let's talk. And she said, I'm approaching the need for a small hospital And how do I go about it? And I said, let's discuss it. It needed to be built of materials that would not further deplete the rainforest. It needed to be a simple enough construction that patients or their families could do labor on it in exchange for health services. It had to incorporate the organic gardens. It needed to be modular so it could be built in pieces as they were able to raise the funds for it, and a few other functions that she wanted included in it. And I said that would make a remarkable project for a graduate level class of architecture. And so I called my good friend who was dean of the College of Architecture at Georgia Tech, and he, like myself, found Kennery's passion for this work just so contagious, you can't deal with it. And he said, of course we can do that, it'll be fabulous. 2 weeks later, he had a heart attack and died. And then I was facing an interim dean who didn't want to commit to anything. Fortunately, they found a new permanent dean shortly after that who was afflicted with fear of failure. And he says, we have no way to teach kids how to research projects like that in a faraway place like Borneo. And he said it would just be a miserable failure. The next day, one of his students came in who was from Indonesia, going for his PhD and ready for practice teaching and looking for his assignment of a class to teach. So it just fell right into place with perfect timing on this. He taught the course for 3 semesters, and the parents of the students involved in it, it also incorporated Emory Medical School, by the way, but the parents of all of the students involved in it caught the same passion for it. They funded their trip over spring break to go to Borneo, the entire class and the professor, to work with the staff there, instead of going to the beach like everybody else did. And so when they got ready at the end of the first semester to present their conceptual design to Kennery Webb, all of the parents came to the presentation also. 3 of the students came back to Borneo for the summer and helped do manual labor on some of the construction there. So all of these little pieces fell into place. And I was overcome with this huge feeling of motherhood that my thought had become such an interesting design and appropriate for it. And I whispered to Lola at that time, says a story like this, where a young girl goes off to the rainforest to study orangutans and eventually builds a hospital, that needs to get documented somewhere. And I said, how do you get a documentary done? And we thought about it, and nothing seemed to work on it. A week or so later, we were invited to a program and dinner put on by Channel 26, WETA. And as they went through their presentations for what would happen over the next year, then we had dinner, and we were seated at a table with 6 people. I didn't know who they were, other than one was a development person for the TV station. I said, if somebody has an idea for a documentary, how do you get it done? And somebody else said, well, what's your idea? So I spent about 15 or 20 minutes going through elaborate detail of the story, and when I finished, they all said, who wants to give him the card first? It turned out they all worked for the same company, but the elder statesman for it gave me his card. He says, I'm Les Crystal, I'm president of McNeil Lair NewsHour, and I'd like to do the story. And they did. I gave them all the connection information, and they went to Borneo with a crew, and 8 months later, they presented their documentary on my birthday over television, and it's still available on Health and Harmony website or on the PBS website as well. But you just have to fall into place sometimes with these things perfectly. The third incident that I was related to, pardon my 45 minutes here, but on one of the other trips back to the U.S., we were starting to think about the construction of the hospital. I said, if you've got time, let me arrange a meeting with the CEO of Virginia Hospital Center in Arlington and get some ideas on how you might get donations of equipment for this hospital. And so he set up a meeting with some of his suppliers, and we went to it, presented the whole story of Health and Harmony. And the next question that came back to us was, you know Walter Reed Hospital is closing, how many beds do you need? So I think it was 35 beds that were committed to go to you, so be sure to collect those.
Just have to figure out a way to get them shipped.
Right. So, but anyway, I think timing is also a key ingredient, and I don't know how you control it, but you got to fall into it. And if you're working on the right project, I think it probably will fall into it. So,
Thank you. That was a great birthday present you got. And sort of just a wonderful story. I think a really compelling story, and we very often don't get to hear. Those are the stories that we don't get to hear. Those of us who are working in this community and working with practitioners. So I would say thank you for coming today. Thank you for your support of this kind of work. Thank you for being a champion, and thank you. I think I would say, and Michelle, I'm sure you'd agree. Thank you for being a partner and really helping things like this happen. So very inspirational and a wonderful way to end our discussion today. So thank you. Please stay around. Michelle and Lisa are here for a while, and I know they would be happy to chat with you further. Thanks so much.